Bienvenidos al ciclo especializado de formación.
Welcome to our specialized cycle of formation in health, work, and stress of ARL SURA in an alliance with SURA, the group of investigation of Los Andes University, and the Center for Social Epidemiology. Please remember that this cycle has 4 thematic axes, 10 conferences, 9 experts from 4 different countries, and it's the equivalent of 15 hours of training. We have 1,500 participants from 747 companies from 114 different activities. And we hope that with the knowledge that you're going to develop throughout this cycle, we're going to positively impact the conditions and working conditions of over 600,000 workers.
La asistencia va a ser tomada al final del evento.
Attendance
Pueden
is
estar
going to
tranquilos,
be
faltando
at
los
the end
últimos
of the
10
event,
minutos.
so you can relax. When we have only 10 minutes left, you're going to receive the link so that you can check your attendance. If you attend the whole cycle, you will receive your certification, and if you attend to just some particular conferences, you will receive your certificate for that particular one. At the end of the event, you'll find our talk of today.
Para mí es un placer
And,
entonces.
for me, it's a pleasure to welcome you to this new event. Today, I have the pleasure of sharing the stage with my colleague, Dr. Viviola Gómez, who I'm going to hand the floor now. She's going to present herself. She's going to be with us in the first part of the session. We're going to talk about evaluation and diagnostics. And we've learned after a couple of several years of our first normativities. Viviola, welcome. Good morning, Sebastián, and good morning, everyone. Okay, so in the first place,
quiero contarles, Sebastián les ha contado que yo
tell you,
dirijo
Sebastián
la
already told you
investigación
that I am the director of the research group called Stress and Health in Los Andes University, but a lot of people not necessarily know what I have studied and what I've done in my life and why I'm talking to you today about these topics. So I am a psychologist from Los Andes University. I also have a doctorate that I did in Germany, and my research work to get my PhD was about the relationship, stress and health, and the reactions of the immunological system. So this was in 1994, and since then I have been a teacher of Los Andes University. Today I'm an associate professor, and I have carried out several investigations related to stress and health in general, and in particular with stress that comes from work, stress that arises as a consequence of working conditions. So this is why my research group is called Stress and Health. I have researched different types of working conditions, different occupational groups, different results in health, different health problems, and also physical problems like cardiovascular in particular problems. And I have taught for over 30 years about stress. So I have a good idea of the sort of confusions or questions that people usually have regarding this concept that is crucial, the concept of stress. And so this is why it's one of the concepts that we want to work on today, because we have also realized that in this group we've seen we still have some confusions about it. So I want to mention something we did with Sebastián to prepare this presentation that is directed to the particular group we have with us today. If you've been with us in the previous sessions, you may recall that I have been taking notes and your questions. And I've had the opportunity of looking at all of the questions, and some of the questions have not always been answered because they were relevant for the topic we were seeing that specific day. And so I have a collection of questions that were made about conceptualization that not necessarily were answered at the time, but I have them here, highlighted and organized. I'm seeing them right now. But with Sebastián, we used them to prepare this talk to you. So I hope that some of the things that we're going to present, they are specifically designed to answer your question. And the other thing I wanted to say is most of those questions are designed according to your questions. Others are designed according to my experience as a teacher, professor, and a researcher, because I have talked about these topics with a lot of people throughout the years, and I've seen the type of confusions that people usually have to understand this phenomenon and to make decisions, therefore, regarding evaluation and interventions. So Sebastián is also going to talk about how most of the things that we included here come from his own experience as a consultant with different companies. So we hope this talk today is going to answer some of your particular questions regarding health and stress. So Sebastián, please help me. Okay, this is what I was telling you. Today, the idea is that we're going to try to present in a very short amount of time a series of concepts and criteria that are going to help you make better decisions when it comes to evaluation, what to evaluate, what not to evaluate, how to do a diagnostic, and how to use the information that I collect to carry out a monitoring of psychosocial risk factors. Later, we're going to see what are things related with one of these, with all these aspects. Okay. The first thing that you need to take into account when you're going to do any evaluation, it doesn't matter if it's psychosocial risk factors or any type of factor, you always need to have a theoretical model, a conceptual model that is going to guide the process, that you need to have a clear idea of what the process you're studying is, and what are their causes, the consequences, how it's related to this sort of things. Because otherwise, you're not doing anything, you're just measuring blindly, but without knowing what for and how to relate that with other things, right? So this is what we're going to start first with that theoretical model. I'm going to show you how the process must be integral. You cannot decide things in just one part. You need to plan the whole process. And that process has a series of phases that need to be thought out from the beginning. You need to make decisions regarding how deep you want that process to go, because the process can be very shallow and light, and that can work in certain moments, but then for other occasions, you need to go deeper for your research, and you need to be clear regarding times, when to do it, how to do the evaluation with a more depth, and what types of tools and instruments to use in order to carry out this process. This I measured with quantitative, qualitative instruments, questionnaires, surveys, observation, etc. All right, so let's start with this key aspect, which is the conceptual framework. And I'm going to start talking about the concept that is central for all of this, which is psychosocial risk factors. And then we're going to work ourselves from there, because these risk factors are a risk factor because they generate stress. And so regarding stress, there are an infinitude of confusions and misconceptions. So I want to start there, trying to point out what we understand by stress. Stress is not a disease. Stress can lead to diseases, but it is not a disease. Stress is a response from the organisms. And when I say the organisms, I mean human and non-human organisms of
preparación
activation or
psicofisiológica
psychophysiological preparation to
ante una
respond
serie de demandas,
to a
¿cierto?
series of demands.
Implica
The
prepararse para
activation
atender
implies preparing yourself to
respuesta
attend
de
to those demands.
activación
But when the
no se
response of activation is not solved as it
se
should,
mantiene activada, prendida,
stays activated and on
de manera prolongada.
for a
Cuando se
long period of time,
mantiene activada de
when
crónica o
it is
sensible
chronicle or it is turned on with too much frequency, we could be talking about that activation response is going to become a stress response. So finally, a stress response is an activation response that is sustained. So what are the causes of this? Why would it get sustained? Well, mainly in human beings, but we also see it in animals, is a perception, a prolonged perception. If the perception is prolonged, the activation is prolonged, and there is an imbalance between the demands of the situation, what you required for the situation to solve itself, and the resources that the organism has to solve or handle the situation. So stress is a consequence of a prolonged perception of an imbalance between resources and the demands. And here I want to make an declaration, because when people hear perception, they imagine that it means consciousness of. You perceive lots of things. If you are a psychologist, you know that we perceive a lot more things that we are conscious of. And so to react before the things we perceive, we don't need to be conscious about them, right? So for the situations that can generate stress or stress itself, people can be reacting without necessarily being aware or conscious about that imbalance. Sometimes they do, sometimes they can be, it's possible to be conscious, but you're not always are aware. Most of the time what people perceive is just a sign that there is a problem, that the activation is being sustained. And what is that announcement? Negative emotions. When we feel negative emotions prolonged in a recurrent manner, think that we probably are perceiving stress. But it implies a process trying to discover what are the causes of this. So this is why I'm saying a lot of people think that if you are not conscious or you're not aware, then you cannot have stress. That is not true. The perception of that imbalance may not be conscious. So here to summarize, the responses of activation and stress are similar. What differentiates them is how long they last and how many organic systems are mobilized throughout time. So if the response, the activation response lasts longer, more systems are going to come aboard, like the endocrinological system, the immunological system. A lot of aspects from the immunological system, for example, the immune system, hormones that have to do with reproduction, for example, do not get activated when we have this activation response. And if it's sustained over time, then we are going to start seeing other hormones that have to do with digestion, etc. So psychophysiological responses that we have in the organism when there is an activation, it's very similar to what we have later. But if the response is more chronic, a lot more systems are going to get activated, and so the response is going to start to not be as positive. So the conclusion is that activation is healthy and desirable and adaptive. This is what some people call positive stress. But stress itself is not healthy, it is not desirable and can lead to diseases. Therefore, I myself always invite you to talk about stress when we talk about that negative reaction that can produce problems. I do not talk about positive stress, because then we're going to have a situation like a question we had once here. in one of the sessions, someone was saying exactly that. How do you know where the stress stops being good? Well, stress is never good. And so this is why I prefer to avoid that term, talking about positive stress, because we can confuse people that sometimes feel bad and they think, oh no, that's supposed to be good for me. And it's not good. There are still people who in certain moments, initial moments of the stress process, say, no, I like this pressure and emotion and thrill. Well, yeah, you may like it, but it doesn't mean that it's good for your organism. Okay, so that's why it's important to differentiate activation from stress. Activation is positive and desirable, stress is not. Let's move on.
Ahora, esto es una cosa muy importante.
Now,
Estamos hablando
here's something very important. We're talking about an imbalance.
Por lo tanto, hay ciertos
So
y la
we have, and research has shown that there are certain factors from the situation and from people,
fundamentalmente a
and this
personas porque
applies fundamentally to people because the characteristics that you
no
see
las
here
tienen
are
animales u
not
otros
for
bichos,
animals or other sorts of organisms,
sino solamente seres humanos. Pero
only
entonces,
humans. So what I'm saying here is there are certain factors that are going to increase the probability of that imbalance between the resources that the organism perceives to solve this situation. As you can see here, there are some situations that are vital that require readaptation. For example, our life changes from one moment to the next, whether positively or negatively, situations that have a very high probability of generating stress, having a baby, getting married, getting unmarried, starting college, finishing college, starting a new job, retiring, going to live abroad, starting a new process in life. Always when we have vital situations that require readaptation, that implies that we may not be ready for that. We don't have courses to be parents. Well, now there are some, but it's not the same. And now we get to university and you don't know. This is why we have induction courses now, just to avoid the sensation of uncertainty in people. But that's the sort of situations that usually generate stress to a lot of people, independently of individual characteristics. Now, working conditions, family conditions for everyday social conditions that have certain characteristics that I'm going to point out, they usually increase the probability of generating stress responses. For everyone, it doesn't matter what characteristics that person itself has. And on the other hand, we have some characteristics that have to do with individuals. That make a lot of people who evaluate the world in a certain way, where they hope everything to be perfect, everyone to love them. They have certain perceptions of the world that are going to make me permanently perceive that I cannot, that I am not enough, I'm not pretty enough, smart enough, nice enough, whatever, to solve any situation. Or I have a low perception of control in my life. My life depends on God, luck, the horoscope, Petro, anyone but me. And so in general, I don't have any possibility of controlling my life. People who have that's the type of personality usually perceive more control. When the levels of demands are really high, when people doesn't know how to say no to certain things assertively, when they don't handle time well, when they have low self-esteem, all of these things are characteristics that are going to increase the probability of a person perceiving they don't have the resources, even though they may have them, but it's a person that says, no, I cannot do this, I cannot control this is out of my hands. That's usually the sensation. I cannot do it, this is bigger than me. Okay, so here's what I was saying. There are some characteristics of those situations, the ones I pointed out: vital situations, family situations, working or social conditions that may generate stress. They are situations that usually are very important. So if we don't care about something, if something is not important, that doesn't stress us out, right? Situations that are very relevant or value for the person experimenting them or the organism that's experiencing them. There are situations that I perceive them to be out of my control and that by nature cannot be controlled. There are things that are out of control for people. And if they are out of control, it's more possible that they are going to generate the perception of lack of control in everyone. An earthquake, for example, there are certain things that we cannot control, definitely. And when we experiment them, we experience stress because we say, no, I cannot do anything here. And there are situations that are not modifiable, and that means a change in where I don't do anything. There are situations that if you don't do anything, nothing changes. Because some situations may be negative, but you can say, okay, I'm going to breathe and wait out because it's going to change. It's just a matter of time. Yeah, whatever. It's just a matter of waiting. But there are some situations that cannot be modified. And if the situation is not modifiable, it's more likely that I'm going to perceive it as something I cannot handle. And so imagine what it would be. And also if the situation is recurring, if it happens frequently, because if it only happens once and then it disappears, it can be very terrible, but it's gone, it's over. Okay, if it didn't produce any other type of consequences, then it might be over. It could be important, but if it didn't leave consequences or consequences that I'm going to experience every day, it's going to be fine, right? Finally, ambiguous situation. The more ambiguous a situation is, the more I'm going to feel that I don't know what to do. I may have knowledge and ideas and resources. I can be very skillful in a lot of things, but if the situation is ambiguous, it's not clear for me what to do, how to do it, when to do it. And the situation also is going to add or have most of these characteristics together. It doesn't matter what's my perception of control, if I am anxious, my personal or individual conditions are not going to matter, because in situations with these conditions, that's going to generate stress for almost anybody. And what we're going to see is that work, psychosocial conditions that certain models have recognized have these characteristics. So this means that individual characteristics are not really that important.
Ok. No, del anterior, Sebastián. Gracias. Entonces aquí lo que es supremamente importante entender es que
what's really important to understand here is that stress in general is a risk factor for health. Doesn't matter if stress is comes from work or not. The stress response is a risk factor for a lot of health problems. If you are not clear when we talk about risk factors, we're talking about a situation or circumstance that increases the probability of a person contracting a disease or any other problem with their health. So this means that people who are affected by that risk factor are going to have a greater risk of being sick. This needs to be really clear for us to understand what we're talking about here.
Una cosa que creo que es claro para todos y
something that I think it's pretty clear for everyone is that there are a lot of psychosocial factors, situations that are psychological and social that may generate stress and therefore affect health, and that come from job or are extra laboral, or they may be individual. So here I'm going to talk about conceptual things, some of which I think are not clear enough, and many are not clear enough. And so I think that
que obliga a las organizaciones
2644 resolution here in Colombia that mandates organizations to handle these risk factors contribute to this confusion. The resolution says that risk factors can come from the job or your family or social. So there are a lot of risk factors, but one thing that we need to be clear about is that they don't all affect your health equally. some factors are more important than others, whether they are job conditions or personal conditions or social conditions. A lot of things may generate reactions, but they will not all affect health
Por
in
lo
the same
tanto,
way.
es importante
So it is important to guide yourself
que
with
permitan generar
research and investigation that are going to generate theoretical models that have empirical
los datos.
background. What does the data say? What does the research say that is going to allow us to say what's more important? What impacts health more? If you think about right now about the 2646 resolution,
La cantidad de factores de riesgo.
the amount of risk factors, psychosocial risk factors that they
Yo tengo
enumerate is, I have here right now a list of
la batería y que
some
no
of the ones that are included there. Space, privacy, physical conditions, intrinsical working conditions, a lot of work, not enough work, pressure, complexity of the task, responsibility, demands in the processing of information, etc. Leadership style, the lack of feedback, etc. And I can continue with this list, endless list that we should then evaluate all of these things because they may affect a person. Conflicting tasks, and job security, communication, interpersonal relationships, etc. And here I'm just mentioning job conditions. So if we don't have a clear model or research that are going to help us
pues vamos a pensar que
make a decision, we're going to think that everything is equally important. And I do think that
y la batería
resolution and the tools give us this idea that everything is important, equally important, that we need to evaluate everything. But at least I think that is not going to give us a clear model that allows us to say, okay, if I evaluated this and this is wrong and this is wrong and I have 50 things that are wrong, then do I have to intervene everything? No, because not everything is important enough. Equally importantly, it's not going to affect your health equally, and so it's not going to be serious enough.
por ciertos modelos. De ahí
That's
que
why it's important to have models, and that's why we started this conference cycle with that model, or two of the models
están basados en
that are based on research
Esos son
about
los modelos
stress. And those are the models in our job context that we've called demand control, social support, and imbalance, effort reward imbalance that you heard by Dr. Secrets and Dr. Karasek. They are models that allow us to say, okay, yeah, there might be a lot of things that can affect us, but they are not all equally important to decide what I need to evaluate. And if I evaluate everything and where to point your interventions, well, some things are more relevant. So I'm going to really quickly remind you of what those models say. Sebastián, please. And please remember that the model of demand control says that working conditions, job conditions that most affect everyone, no matter their personality or their coping mechanisms, that doesn't matter, are those that have high demand, as you can see here, in the red, high demands, low control in work, which is understood as capacity of making decisions or using skills to carry out your tasks. This combined with low social support, then the situation gets even worse. So people who with high demand, low control, low support have most risk of developing health problems. This regarding the demand control model. Now for the effort reward imbalance model, what it says is we as human beings have basic needs of receiving certain types of support, and there are certain rewards. Let me look for the right word.
que mis esfuerzos en el mundo
the need of feeling that my efforts in the world are
que
going
me
to
da
be
cierta
compensated, and that is going to give me certain stability and
sensación de
security
competencia,
and
de
a sense of competence, of,
y lo que
of being
dice el modelo de
regarded.
Sigris es
And what the model of Sigris says is that in work, when people are carrying out very high effort in education, commitment, solving
pues
things
tiene
they need to solve, they have a minimum
su
expectation
esfuerzo
that
esté
that effort is going to be compensated with
que me
something that is
permita
equivalent to my education, that is going to allow me to have stability,
si
not that
mañana
I
vaya a
carry
ser
out all of the effort, but then tomorrow they fire me and I don't know why if I have been carrying out my job
y que si he hecho mi
the
trabajo
right way. And if I have been doing
pagar
this and they
formalmente todo lo
cannot
que
pay me
debería
what I fairly should receive, then
al
at
menos
least they should tell
reconozcan
me thank you and recognize for my own
hecho un buen
mental
trabajo.
health
Gracias,
that I have been
gracias.
doing a good job. So thank you, Viviola, for your job. I would like to pay you more, but I don't have the money. Or
Esto,
here's your money. This is what you deserve fairly because of the effort you have been
reconocimiento,
carrying
seguridad,
out.
estima.
Recognition, security,
Se
esteem.
manifiesta la
So those are
recompensa.
different ways of manifesting rewards. And when there's an imbalance in
Caso del
this
modelo de
sense, in the case of Sigrid's model, there's another factor, he
incrementa
says,
esa
that increases
de desequilibrio.
that perception of imbalance, and that
Es
is
cuando hay
a
personas
personal factor. That's when people that
es lo que él llama
make an
sobrecompromiso.
effort that goes beyond what they are asked for.
Que
People who
hay
think
que
that
hacer, hay
they
que
are
hacer.
indispensable, like I have to do this, I have to do this, if they are asking for it or not. I come home and I continue to work, even if no one is telling me to do it.
Tengo una
I just do it
característica
because that's my personality,
yo
and it's going to
necesito
make me
estar
think that I
todo el
need
tiempo
to continue to control everything.
Mira,
Because if
pierdo
I
mi
relax
trabajo,
and let go, I'm going to lose my job, lose control of the situation. So
que aumenta
that's a characteristic that is going to increase the perception of imbalance, and that's going to activate me and generate stress.
Uy, Dios mío, me estoy pasando muy.
Oh my
Oiga,
God, I'm going to be a little quicker to not take
entonces,
your time away. So what I want to say here is that
tienen un par de
these terms have a couple of characteristics that are important for you to understand.
científicos, es
They
decir,
are analytical models. So this means that they have selected on the base of theoretical theories in research and results, empirical results. They have chosen some of the many factors that affect and that generates
todo el mundo,
in
a
work
todas las ocupaciones,
that
no
affect
importa,
everyone, all occupations. It doesn't matter if I am a psychologist, a
conductor de
nurse,
bus,
a
son
bus driver, they are general.
no importa, pero lo que
And
quiero mostrarles es
another
que
thing that doesn't matter right now, but I want to show you is that there are models that
algunas
apply to
personas
everyone. Some people, some of the previous sessions
hago
were
para
asking, how do
yo
I
tengo
understand stress if I have people who work on this or on that,
personas
with heights, with it doesn't matter.
analíticos que
We
les
have these analytical
hacen
models
y hay
and they present, and there are some others, these are the most important ones,
factores que son
that
generales.
present those factors that are general for every occupation.
Ah, perdón.
Oh, no, I'm
¿Ahí
sorry.
está bien?
Sí, Sebastián, sí, no es que estaba aquí tirando.
Yes, yeah, it's this one. I was looking at a different thing. Okay, I think
Pasemos a la
I've said
siguiente.
this already, so let's move on. This is very
Las
important.
dos que siguen son claves para.
Next two slides are very important in order to convey
Entonces,
the
en el
message I
trabajo,
want.
¿qué
So at work,
física
what things can affect physical and mental health? If you look at it, at least we can identify some things that have to do with physical characteristics of the job, of the work, that are studied by occupational health sometimes, which is not psychology. But a lot of people who work in
físicos,
this are
exposición a
paying attention to chemical exposure risks, for example, ergonomic conditions, etc. Now, at the end, we can see conditions that have to do with the skills that people have regarding the salary they receive, that is going to allow them to have access to certain type of food or healthcare.
Nosotros nos interesa.
But the ones that are important for us today are the ones you see in the middle: psychological, psychosocial aspects of your job and how the job is organized. Factors that generate stress, those are the ones. For us, the resolution shouldn't force us or invite us to take care of what's in the part in the bottom, or and that we're going to see that in this next slide, yeah, in this one. If you see here, you can see at one side job stressors. From the point of view of the organization, the most important thing is job risk factors. Yes, of course, we're going to have some factors that come from outside work, like financial situations and family situations that are going to affect it. But those factors, from the perspective of the job characteristics, may buffer, may aggravate, or may buffer the effect, moderate it, making that the effect to be bigger or smaller, but they are not the original factors, essential factors. If you think about the models that have been developed around the world to understand health, they talk about the 1,000 things that socially or psychologically may affect health. But for organizations, you cannot ask them to look at the personality of everyone and their coping mechanisms and their social conditions and the pandemic and everything. No, those are situations that governments need to attend to, the countries as a whole, the WHO, they need to pay attention to this. But from our point of view, from the organization point of view, the model needs to be this one. Psychosocial factors, what sort of acute reactions that we can detect on time before they become diseases. This that you're seeing here is the model developed by the NIOSH, the National Institute for Occupational Safety and Health of the United States, and several countries have similar models to guide evaluations in organizations. They say, okay, center your investigations in working stressors, job stressors, and look at what you can change. You cannot change if people have transportation or not. You can change whether you pay them more. You might change or offer them possibilities to eat better if we have a good restaurant or casino in your company. But the main responsibility of companies is going to be psychosocial conditions of the work, those stressors, job stressors. And so you need to look at this as we have it right here. Stressful conditions are going to affect and produce factors, health problems, and situational and individual factors are just a middle factor, a moderator that might or aggravate the problem or protect people from the other factors, but they are not the main factors and they are not the responsibility of organizations. Therefore, and I think with this I'm going to finish, the responsibility of evaluating, preventing, and intervening in all of the factors that may generate stress is not only from organizations. Organizations needs to mainly prevent, and then intervene in those factors that are coming from work and maybe in some social ones. There are some organizations that are interested or have the ability or have the power to change in some social situations that may make it easy for everyone, for example, regarding transportation. But that's not the responsibility of organizations to change the world or changing that million things may generate stress. They need to look at the ones that come from work and that we know may make everyone sick independently of whether they have different personalities. So finally, in the long run, it's important to know that measuring risk conditions is not enough, and this is very important. We're going to see it if time permits it. And that measuring conditions is important, very important. But in order to have a proper surveillance, we need to also measure resulting conditions for health and for the organization. If you want to be able to conclude, as some people were asking, how do I know if what my people have comes from work or not. If you don't have a surveillance system, if you haven't evaluated regularly or constantly what sorts of conditions your workers have and what sorts of health problems you're seeing, it's very hard to show whether the organization is responsible or not. And then we have to look at each particular case. You should be able to have what we have here next, which is a system of information that is going to allow us to do epidemiological surveillance and systemically collect data about health and psychosocial conditions so that you can guide your policies, your health policies within your company and establish measures that are prevention first and promotion of health before the problem becomes a disease and you need to intervene or heal.
Okay, ya aquí le voy a hacer una
Okay, so
introducción.
now I'm going just to introduce Sebastián. So here we're going to look about what to measure, how often to measure, who do I evaluate, and a lot of this depends on the organization. You don't always need to make the same decisions for everyone because in some cases it's important to measure absolutely everything, and in other cases it's important to measure everything just at one point and then carry out other measurements in between. How do I know how often to measure? Well, it depends on what we're measuring because some things change very quickly and some things change really slowly. So this is going to be the strategy and it needs to be based on knowledge. And Sebastián is going to show you this. Some things usually used because they don't very immediately, they are more midterm and they can be used for these epidemiological systems.
Okay.
Okay.
Aquí
very quickly here,
interesante que ustedes sepan que hay
it's
muchas
interesting to know that there are lots of ways of evaluating. The battery of the ministry offers a series of things that go beyond the questionnaire, which I think is what most people use. The battery offers options to do focus groups and interviews and observation.
Allí ustedes van a ver que
and there you can see that we have something we call imputation, that in Colombia we cannot do this because Colombia we don't have national data, well, that are enough in order to say, okay, we don't even need to measure this because we know this sort of occupations in these regions have bigger risks, so just intervene right away. Anyway, so it's important to think that all of these things can be carried out, and I'm going to finish with my intervention with the following. None of them is better than another. It depends on what you want to measure. None of these is going to be completely objective. What we know is that observation is more expensive and slower. It can usually exaggerate or increase the size of the problems that are detected. Questionnaires and interviews and groups are usually more objective, more people are cheaper. But what's interesting, and this, I think Karasek or Sigris mentioned this, there's a high correlation between observation and the information we get from questionnaires, interviews, and focus groups, as long as those questionnaires, interviews, and focus groups are designed properly. Because it's not a matter of saying, I'm just going to make up a couple of questions and evaluate. That's what Sebastián is going to talk about, how to know what are good measurements or reliable measures that are going to allow us to know that what we're doing is measuring something properly, even if it is underrated or overrated. But all of these are usually good tools that are very precise and exact. They all are going to have a margin of error as any tool anywhere. A ruler, anything is always going to have a margin of error. So these tools also have them. But if you build them correctly, they are going to work. Sebastián, I am sorry, I took a lot of the time and I think we're going to go over time a little bit. No, it doesn't matter. Viviola, don't worry. It's a pleasure for us. You're sharing all of this with us. I thank you. Now in the last part, we're going to be, Viviola and I trying to solve all of the
Como
questions.
ustedes han visto, pues hemos dedicado
As
gran
you've
parte
seen, we have dedicated a big part of this talk
elementos
to talking
conceptuales
about the conceptual elements that we need to take into account when we're going to
social.
carry out
Y
diagnostic of psychosocial risk. And this
esto
is not
tomamos una decisión
fortuitous.
de que
We made the decision that this series of concepts need to be explained, and it was a relevant aspect, very relevant aspect of this talk,
coincidimos en
because
que muy
Viviola
probablemente
and I agree that one of the biggest mistakes we make in those processes of evaluation, and that presents a lot of challenges, is the fact that we don't have
lo que
a
realmente estamos
conceptual model that makes us understand
evaluando
what
en la
we are
medición
evaluating, what role they plays in the measurements.
por
So
todos
this
estos
is very
conceptos
important. It's important to
que tienen
understand
que ver
these
con
concepts,
día
and
a
then
día
we
y la
can move
operación
on to the day-to-day operation and practical issues of
organizacional. Al
evaluation and
respecto, yo les voy a
diagnostics.
hablar de ello
So I'm going to
porque
talk about this
llevo más de 10 años
because I
dedicado
have over 10 years of experience in
y un tema
organizational
que a mí
evaluation
me
and
ha gustado,
diagnostics. It's a topic that I like very much. I started to
donde hice
study it
precisamente una
from my graduate degree, where I did a standardization evaluation of an
infantil
instrument
y
to
de allí
measure child depression. And there
la empresa que fundé,
really
Prax,
started to like this. I started a
en
company
evaluación
called
y
Prax, and I
diagnóstico,
direct this company, and it is specialized in evaluation and diagnostic.
millón
And
de
by now we
evaluaciones.
have carried out more than 500,000 evaluation
Entonces
and
quiero
2,000
compartirles algunas
evaluations
de
of
los
risk factors. So I want to share some of the knowledge and the
al
experience that we've
respecto.
had.
Viviola lo mencionaba,
Viola mentioned this. The
hay muy
tools, well, we
variados,
have a lot of tools, and there are a lot of variation. What's most
calidad
important is
psicométrica
the
del
quality, the psychometric quality of the instrument,
utilizar, no en el contexto
because
colombiano,
we may use some of
esta
these
necesidad
not in the Colombian
normativa,
context to answer to normatives or laws. As we mentioned, in Colombia,
con la
you can
batería
only work with the ministry's battery, but some of them are the
IRA,
JC2, the ARL
ISTAS que viene
is
del
21
cuestionario,
instrument that comes from the questionnaire of Copenhagen.
inclusive una misma empresa de
Even a company from SURA
desarrolló una batería
developed a battery of instruments to evaluate psychosocial risk. Viviola herself and I, in alliance with her research group,
desarrollamos
Prax,
también hace algunos
we
años
have developed years ago a battery to
psicosociales que
evaluate
precisamente
the psychosocial risk factors that
la
have
situación es que la batería
as an axis JCQ. But right now in Colombia, the battery of the
y lo
ministry
que
is
hemos
the only one we can use. And what we wanted to give you here is a series of knowledge that are going to help you understand and give the best use possible to those data that you're going to gather with this battery of the ministry when you want to carry out an evaluation of psychosocial risk for normative purposes.
Cualquiera de esos
What's most
instrumentos
important, independently of any of these instruments that we are using here, is
cuente con
that the
adecuadas
tool has psychometric
dentro de las
properties
en
that are adequate, and this is called reliability. Most of the people, what they know about a psychological tool is the questions and the options of answers. So it's not unusual to observe that a lot of people think that it is as simple as formulating some questions and some answer options. It's a complex process in psychology. There's an area called psychometrics, and we've been working in that for years and profiling and improving the different methods to guaranteeing that when I collect information through an instrument that is usually called the paper and pencil, and this means questions with options of answers, we are actually carrying out a quality measurement, and this quality is going to be determined by reliability and validity. Reliability is just guaranteeing that the instrument I'm using is not going to present different results when there is not something that has influenced those results. So, for example, if you weigh yourself at 6 a.m. and you weigh 65 kilograms, but then 10 minutes later you weigh yourself again and you weigh 85 kilos, nothing is going to explain that in less than 10 minutes you gained all that weight.
Usted
It's
no
a
puede
reliability problem. You cannot trust the data that the scale is giving you.
instrumento de medición esté
Even
midiendo.
if that tool is measuring weight, is not
Validez se
reliable.
refiere
Now,
a que
validity means that the instrument that I am using effectively
supone que
measures what it should measure. Let's return to the scale example. If I use a scale, it should give me a weight measurement, not a distance measurement. Yes, I would be evaluating the wrong thing, so it wouldn't be valid. All of the tools need to have adequate levels of trustability and reliability and validity. So this means that the instrument doesn't, results do not vary when they shouldn't, and they are measuring what I actually want to measure. And this is carried out through studies that are hard to make. They take time, in no less than a year or two to carry out an analysis of this sort. So any tool or instrument that has these conditions, that it is reliable and valid, we can use them very comfortably to make any measurement. In Colombia, for psychosocial risk, I repeat, it is regulated. We may be able to evaluate it with the battery of the ministry, even though we have other instruments that are reliable that would allow us to do this. So you may wonder, Sebastián, who says if an instrument is good? In my experience, a lot of people contact you and tell you, oh, and is this instrument validated? And validated means administratively by the ministry, as if there were an entity that approves or not the use of certain instruments. And in the world in general, we don't have this. It's historically, what we've been doing is that psychologists, who are the ones that use this type of tools, they are the ones who evaluate the psychometrical quality of the instrument, and they make the decision whether it's going to be adequate or not for a certain population. And that is our responsibility, and it's us as psychologists in general in the world, the ones that are going to have to guarantee that we are actually using a good instrument. So what determines that we have a good instrument is not just one research. This is something that I really like, and I find beautiful about science. We need to generate a level of agreement in the community, scientific community, regarding the quality and the conclusions that we are finding when we study a phenomenon. So we may say that an instrument is a good instrument only with multiple researchers using multiple samples and working independently and systematically find that that tool is actually trustable, reliable, and valid. And so they may take years. A lot of time may go by, and here's what we need to be open to constantly study and test different populations. So particularly for the battery of the ministry that came out in 2011, this battery assumes certain concepts that come from the control model, the demand control model. You can see it here. It talks about work conditions, demands of the job, control, leadership, rewards. Here you can see outside of work conditions that are outside of the formulations in the demand control and support, social support and ERI models. But what I wanted to say here is that even though we have certain concepts that do take these models into account that they are very important, they actually do not contemplate the most important element of those models, which is the combination of these variables, which would seem to be what predicts a higher probability of having diseases generated by stress. That combination has to do with high demand and low control at the same time, and high effort and low reward at the same time. So we can see here that there's a structure. The battery of the ministry has different types of tools, as Viviola mentioned. There are some instruments that may be classified as paper and pencil. They are applied through questionnaires, but it also has very good instruments that are going to allow to measure and evaluate risk factors regarding using interviews and observation and focus groups. In my experience, when you do a very good diagnostics using questionnaires or surveys, it's not unlikely that you may need to use the other mechanisms as well. You need to do a good process of diagnostics, because we also need to guarantee the quality of data collection and processing. And if I don't do these things well, then I'm going to have results that are going to be weird, and I'm going to need other measurements to understand. Sebastián, I'm going to interrupt you just a second to add something that I announced before, which is how deep to go. Many times, interviews and focus groups are used to get into detail about things you've identified in the questionnaires, but that the questionnaires are not going to allow me to understand what is going on a deeper level. So interviews and focus groups are going to allow me to get into detail with people to understand why certain situations are happening.
Gracias.
Yes, thank you.
Otra utilidad
Another utility that is important regarding those instruments have to do when we're going to do evaluations where the sample I'm going to evaluate is too small. For example, in companies that have less than 10 workers, it's not very useful to carry out statistical calculations with a sample of that size. So in these cases, with these methods of observation and focus groups, because they don't depend on the sample size, then they are perfect, because we're not going to have the problems that we may have when we do statistic diagnostic. Other information that's important to know here is that you have to remember that if what we want is just to meet the requirements of the ministry, this is not going to cover everything that you need to take into account, because the law says you need to evaluate other things that are not included in the battery of the ministry. They are exposed in the law, and we need to have data and recollect it.
¿Cuál es el proceso en general que debemos de seguir?
What's the general process that we need to follow in order to carry out a diagnostic of risk factors? Preparation is the most important thing. Two key aspects are classifying your workers in the work centers where they work, in particular in the positions they occupy. As we've seen in this information cycle, the exposition to psychosocial risk is determined by what the organization is asking me to do and the conditions they are asking me to carry out my work. And what groups is better, what people do and the conditions to do that are the positions. What doesn't happen with organizational evaluations, where because of the models that underlie this concept, the most important thing is the primary social group where the worker is. In those cases, doing filters and analysis by working groups is more relevant than doing them because of positions. But for psychosocial risk, it's not the case. For psychosocial risk, it's key that you classify and organize positions of your workers so that you can carry out the filters. And this is important to do evaluations of stress-induced diseases. You need to be able to qualify your individual and study them and know what position an individual occupies within a company so that you can understand the causes of the diseases that you're trying to qualify. So for our diagnostic, we need to organize working center positions. We need to know minimal data about identification of the worker and occupational information of the worker. In the battery of the ministry, is very important that when you carry out the preparation, you do something that's called classification of workers. The battery of the ministry has two ways. One is called Form A, Form B. I'm not going to talk about that. And one of the most common mistakes there is considering that classification is done regarding the schooling level of the worker. That is false. The classification is carried out regarding the type of activity that the worker carries out. And the ministry, the battery ministry gives us 4 categories where they tell us if it's a directive, professional, technical work, apply Formula 1, and if it's essentially operative work, apply then Form B. And there we need to check and do a good classification so that you don't apply a form that doesn't correspond to a certain worker. And what most processes have usually, which is assignated days and hours and time and places for the evaluation, the ministry's battery can only be applied in paper, having communication campaigns, and applying the tests, and then after the tests are collected, when we have the papers and the forms back with the answers of the workers, we need to carry out a process that is tabulating the information in the system, or maybe manually you could do it, but that is practically impossible to do with the extension that the battery of the ministry has, where we add the answers that people gave, and that
resultados
becomes
para finalmente
results.
tener tres tipos de
And then
puntuaciones.
finally, we're going to have 3 types of scores
La
that
batería
are
del
the ones that the
ministerio,
battery of the ministry gives us. After you tabulate and process the responses of the workers, it's going to generate 3. A brute punctuation that is not useful, don't pay attention to that. Another, which is that transformed score that comes from
transformada sobre la cual debemos
the
concentrar.
other score, that is the one we need to really take into account. And then there's a qualitative interpretation of that transformed score, and that the ministry calls level of risk, but that actually has to do with how usual or unusual is the score a person or group of workers received regarding what you usually find in the Colombian population. And this is going to generate a table like this. You see the workers, and then you have for variable 1, for
Esta tabla,
the
los
levels.
empleadores no deben ni pueden tener acceso a esta información porque eso es
Workers
información.
cannot and should not have access to this information. This is confidential and it is protected by
Realmente tener
clinical
estos
history,
datos
and they don't really need this data like this. Is not relevant
con esto es
for
el
the employer. The one who works with this is a psychologist that is a specialist in
Y hasta
working condition or occupational health. And this is as far as the ministry's battery takes us. It doesn't say anything else regarding what to do with those data or how to process them. These are the instructions, as it should be with an instrument. They just say, well, just get these results, individual results for these.
en adelante tiene
So
que ver
then, what comes next has to do with key aspect number 5, which is the diagnostic. We need to understand that we do it to answer one single
pregunta tiene
question,
que ver con qué
which
pregunta
is, what is the question I need to answer
lo
in
más
order to induce action as quickly as possible in the most precise work of the employer regarding the controlling the risk factor? And that question is, what are the psychosocial risk factors, working risk factors that are most relevant in your company and that therefore have a higher probability of affecting health and organizational results? All of what we do in evaluation and diagnostics is just to answer this question. And answering this question requires
un proceso que
2 different processes. One that is called description of results, and one that is called analysis of results. In the description of the results, what we essentially need is to use statistical techniques to represent the findings that are found. This is not something to just make up. It's not a weird analysis. This is just general statistics, basic statistics.
importante que yo he encontrado
Something important that I have found in my experience is that this sort of statistics
ser muy usual o conocido
usually is not very well known
de gestión
among
humana,
people
en
who
seguridad
work in human resources or
que si no
safety and health in work. And if we don't have minimum knowledge about
tomemos un
statistics,
curso, existen
we need
muchísimos
to take a course. There are a lot of courses because it is basic in order for you
resultados
to
que nos van
interpret the results that a diagnostic are going to present.
Dentro de esa estadística descriptiva,
For this
nosotros calculamos
descriptive statistic, we have
muestras,
minimum data, like
el mínimo,
the
el máximo,
sample, the minimum, the maximum, the media, the standard deviation, the variation coefficient, the exposure, the level. As I was saying, this is nothing new. These are concepts that already exist. It's just using them properly. Something I want to emphasize is something that I found and that worries me a lot. Is an important challenge is that when we carry out these diagnostics, organizations and colleagues are relatively calm when they calculate the mean score. Here is this one that we see here, and then after that medium, they calculate the level and they say, okay, according to this, the medium, this mean is low or high, and they then are just relaxing if it's low or medium. valuable, and they only
No lo
want to
debemos de hacer.
intervene if they get a high score. And we shouldn't do this because we cannot treat a
Social
diagnostic, a social diagnostics that involves a lot of people
diagnóstico
as you try individual diagnostics. In an individual diagnostics, you apply a test, you obtain a score, and then you know what to do. You just analyze the results. But when we do diagnostics, where there are a lot of people involved, you are already subject to aspects
la
such
forma en que
as
se
distribution or the way scores are distributed for that group of people. So if you base yourself only in the mean
usted fácilmente
score or the average score, you might be concluding that there's nothing to do when actually you do have things to do. Why? Because you didn't calculate other statistics, and the best way to understand this has to do with distribution of the sample. When you evaluate a group of people, the normal thing is that they are going to present a distribution like this one, which is called asymmetrical distribution. Most of the people are going to be placed in the middle of a scale that we're using, and the extreme scores are going to have a lower proportion of population. But this is not always the case. It's what you would expect.
casos en los cuales
We
cuando
can have other cases in which when you evaluate, you have a great proportion of workers concentrated at the right of the scale or at the left of the scale. And there, to say that if we talk about the level, it's not as problematic if you have these sort of distributions. The problem comes when I have atypical distributions, such as having at the left a curve and then another curve at the other side. So when I have distributions like that, because I am trying to make an average of different people with different risk levels, when I make an average, I'm going to have this media in the middle, and that's going to be the equivalent to the average, and then I'm not going to alert about anything. So what we have to do in these cases is to consider more statistics. For example, the percentage of exposures. When you take into account both statistics, then you're making the instrument more sensible to detecting if there's actually a problem in the organization. So whether it's on one side or on the other side, and this is how we can more certainly alert an organization when they need to start to take action on their population. And this is what has to do with the description of results, which is a different process from the analysis of results. I just described them, but a different thing is to analyze them. How do you analyze them? What we've seen from the start of this cycle, from the start of this talk, becomes very important. In order to interpret those results, you need to know your theoretical models, your backgrounds, you need to be able to interpret the statistics, and especially decision criteria that are going to help you to process or analyze the information. And those decision criteria should be automatized, preferably. 10 years ago, when I started to carry out this sort of diagnostics, I used to do them manually, and for me, a diagnostic could take 2 weeks, and that meant cognitive effort. And I started to realize that when I was really tired, I was more lenient and tolerant in interpreting the result, or least tolerant. So that's not okay, because you end up making decisions just because you're exhausted or tired, and not because of the standard criteria that you should be using when you decide what applies or not.
Por esto es que es vital.
This is why it's important that we use automatic concepts for this analysis, and the criteria are simply what we call clauses, if-then clauses, that have a high correlation. So if you analyze, for example, a variable such as job strain, a formula for operationalizing this could be: if job strain is higher than 1, then intervene. If it's any other value, then don't intervene. This is very easily to understand. There are some analyses that require much more clauses and that are connected between them with connectors such as or and.
Resultados
But
no
for
hay más.
the analysis of results is just applying your knowledge, the experience you have in order to create rules that are going to allow you to interpret the results.
La recomendación es que en general a la hora de analizar
Recommendation is that in general, when you analyze the
contemple
results,
la
you
puntuación
at
promedio,
least contemplate the average score, the level, the exposition, which is the amount of workers that were exposed to a risk factor, psychosocial risk factor, and associations. Here I would only say something extra, which is whether, even though you need to contemplate associations, you need to understand that applying those associations implies a specific knowledge regarding how to apply statistical methods. And if you apply an association but don't find the results,
con
the
una
associations of
consecuencia
this risk
particular,
factor with a particular consequence, but the risk factor is high,
importante
and
trabajar.
there's an important proportion of workers that are exposed. This doesn't mean that you
Porque
don't
fácil-
have to do anything, because very easily what could be happening is that the disease is being incubated, but you cannot detect it yet, the effects that it's having on health.
medidas y
But there are
controlar,
other variables that are not being taken into account, that are buffering the effects
generar
that
la
are
exposición.
being started to generated by the exposition to certain psychosocial risk
Importante que
factors.
usted al menos
But it is
considere
very important that you consider
y cuando
the
usted
scale
lo
and the
haga,
level. But when you do this way,
reales de la
and
evaluación
these
de
are
batalla.
real data from the evaluation of the battery of the ministry, you can see that here we have the description of the results, where we have the level of the variable,
La
the
máxima, la
sample, the
media,
minimum, the maximum, the medium, the deviation, the exposition, but you may
como
have
este que les estoy mostrando.
scores like this one that I'm showing here, where you see that the level is
Y en esta
medium
otra
in this variable, and in this variable it's medium as well, but then what is green and the
rojo.
other one is
¿Eso
red.
por qué sucede? Porque
Why? Because
la conclusión yo no la
what's
obtengo solamente del nivel,
the conclusion doesn't only come from the level or from
los
the medium
expuestos.
or
Yo la
from the
obtengo a la
exposition. It comes when I apply multiple
en este caso
criteria for the analysis that are represented in a conclusion. In this case, in overall conditions, the
el
level
porcentaje
or the
expuesto,
media or the percentage of exposition,
aunque el nivel fue
the
medio,
expectations, but for the working demands, even though the medium
tenemos
didn't
otro
indicate we needed to intervene, we do have another
que recomendamos tener como
criteria
punto de
here,
corte,
which is the percentage of people exposed,
donde nos indica
where
aquí hay algo
we
atípico, hay
recommend
algo-
that over 30%, then you need to look at it, because that's an
y por lo
important
tanto, al
proportion
margen
of workers that are exposed to this, and that
de
no
trabajar
matter what
sobre
the
estas variables.
average or mean was, you need to take a look at that.
En
Because we
otro,
don't have enough time, I think that in another space we can
mostrar unos
look at this in detail.
comparativos que se pueden
I
hacer
wanted to show you some comparative analysis that you can do with the description
de
of
la
results
información.
and the analysis of the information
Pero yo creo que
by
en otro
occupations, but I think we'll
entrar en
find
detalle.
another space to do that. I would
de
prefer
aparte de
for us to
conocimientos
have the opportunity of in the following
ustedes puedan
minutes
tener, no sin antes
solve
recomendarles
questions you may
presente.
have. Not before
Hemos encontrado la
just
relación de la evaluación.
mentioning some general errors we found. The first thing is that it is not
Interpretarlo en
appropriate
función
to
de las
try to
preguntas que
interpret the
evalúan.
results in function of the questions that
Es usual.
evaluate each variable,
Veo
because
muchos
that
colegas y
happens
colegas
a lot, and a lot of my colleagues try to
de, bueno,
do that analysis of,
preguntas que
okay,
evalúan
what
esta
are the
variable.
questions that are evaluating this variable so that I understand it? And that's how
Los sistemas
verification-based works, and psychological
explicarles pues como
instruments are
todos los
not
detalles
verification
implicaría
lists.
mucho tiempo de por qué
All of the
nosotros
details would
lo importante es
take
que
a
usted
long
entienda la
time to
definición
explain to you why you shouldn't do it, but just don't do
al
that. The
margen de
important
los
thing is that
tipos
you
de preguntas.
understand what you're trying to measure.
Otra cosa importante
And
es que
other
en
important thing is
no existe el
that
concepto de
in psychosocial base, we don't have the concept
eso
of
se popularizó
blank
en
case.
nuestro canal.
This became popular for some reason in
Al
YouTube, in
respecto,
our
hay un
channel. If
video
you want to
donde
go deeper,
explico
there's a video where we explain deeply why
y no es
that
relevante porque
concept doesn't exist, that is not relevant, because finally what that does is
atribuyendo, indicando que la intervención
attributing or indicating that the intervention of social risk
definen
is
como
being carried out in that blank case, which is defined as the person who is
saber
exposed to a
quiénes
lot
son las
of
personas en
psychosocial
la intervención
factors. Knowing who the people
no es
are
útil.
at the level of
Usted
the
necesita
company
saber
is not useful. What you need to know is what are the
cargos
risks
los tiene,
and what
variables
positions have them, or what are the demographical conditions of people who have them, so that
que son las
you can
causas.
get to the final thing after a diagnostic, which are the causes
También
of the
importante,
risks.
que tenemos que tener precaución, es que si a
Another
usted
message
sale un
is
factor de
if
riesgo
you
bajito,
have
no
a
puede decir
low
que eso
risk
es
factor, you
simplemente
cannot say that this means
porque
you have a
para
protective
demostrar
factor,
que esta
because
condición es
in order for you to show that a condition is
que demostrar
protective,
que
you
condición de
need to,
riesgo y que cuando
just
usted
like for
está
showing that it is a
expuesto
risk condition,
a
and
una
when
más
you
alta
are
de
exposed to
personas
it,
que
there's a higher
están
proportion
enfermando,
of people that are getting sick. We would need to
a ese factor,
demonstrate that
en
the
vez de
exposure to this
personas
factor
aumentar la proporción de personas
is
que está
increasing the
saludable y
proportion of people who are healthy, and then this requires another type of
que
analysis and studies and research that generally the instruments
determinadas puntuaciones indican
determine that
riesgo
certain
de
scores
protección.
implies risk condition or protection condition, but in the case of the ministry, a lot of variables are designed to only measure risk conditions.
Esto es lo que tenía para
So
compartirles.
this is what I wanted to share to you today. I think that in the next couple of
espacio
minutes, we
intentar
can try to solve some of the questions that
Ya.
you may have. Yes, Sebastián. I was looking at some of the questions. There are some that are repeated. I hope that in the couple of minutes we have left, and maybe if we can go over time a little bit, that would be great. I'm going to start by answering some of the questions that I did at first. It have to do more with conceptual things, and then we're going to start talking about instruments. So we see if the concept of stress and unstress doesn't exist. My question is, well, my answer is, the concept of stress talks about eustress means feeling positively or feeling well when you experience a situation. I repeat again, with this, I also want to answer to Diego, who's asking if it is a myth saying that if there's no stress, there is no life. Remember that at the beginning I told you, one thing is activation, which is what usually brings people to feel good. Eustress, people are activated, and that response of activation is what a lot of people call acute stress or positive stress. But because stress is never been associated with positive things, that is why a lot of authors and I share these proposals. We do not talk about stress, but about the response of activation that is sustained and prolonged, and that's what really make you sick. But the eustress, if you want to call it that way, or positive stress or acute stress, that doesn't make anyone sick, and so that's not stress, that is activation, it's preparation for action. It is good, it is desirable, but the problem is that it doesn't happen just like that. And here I would have a lot of examples of studies that show the difference between the reactions, but I am trying to answer this concept that if there's no stress, there's no life. No, if there is no activation, there's no life. The minimum level of activation is the one we have when we are asleep, which is a lower level of activation, but we are activated. And then when we jump from a plane or do anything too intense, then of course the activation level of psychophysiological, because it's not only physiological activation, increases a lot. Sylvia asks regarding reward, when you have not conformity and you see in the evaluation that this happens, but the structure of the organization doesn't allow to pay people more, what other intervention strategies you can use? Well, Sylvia, according to the model, and we're going to talk about interventions later, according to the model, rewards can be economical, but they can also be in terms of recognition and stability. So it's possible that at a certain time, the company, because of different factors, cannot pay their employees more. Because sometimes they can, but they won't, right? They don't want to. But what the company actually can't, there's nothing they can do better than gathering their people, telling them things clearly, and doing other things like recognition or guaranteeing people that as long as they are doing their work okay, if I cannot pay you well, at least you are stable. You can know that we are not going to fire you. And if you do your work, you might be promoted within the company. So there are other needs that people have. Or even we can help people understand the deep sense of the work they're carrying out. And with this, I remember a study we carried out in the prosecutor's office here. I remember a lot of the people who were better said, here I need to bring money for my pencils, my paper, because the company doesn't even provide me that. But for me, feeling that I am doing things that help this country be a better place, that made people give importance to their work, and then they received a reward for their work. Those are some thoughts, but later on. Okay, Viviola, if I wanna mention something here. That question can be looked at in the contrary. What happens when I have a lot of money and I pay a lot and I try to use reward as a mechanism to compensate other problems that I might have? That's not going to work. Once I associated a company in the financial sector, and the manager said, okay, no, let's just pay 30 million to everyone and there's no problem. And financial entities do have the resources to have really high salaries. But I was telling him that in a point, after a certain point, just financial retribution is going to motivate you a little bit and you're going to be there for a while, but after some time that's not going to become representative anymore, because once you have stability and you have your basic needs met, then that doesn't work as a reward anymore. So you can see this from both sides. What I tell companies is you need to pay well and fair, and that it can allow people to grow in their family life, in their personal life. But then after that, that's not the most important thing. The most important thing are the psychological rewards of work, as you were mentioning, where work is important for me, it's meaningful, I feel valued, respected, I am doing something that is good for other people. So that's where I think in organizations that are formally constituted, that have the trajectories and have solved these financial issues, need to focus on. Okay, here I have a question that I think you already answered, Paula. Paula Diaz. I invite you to look at the video that Sebastián was mentioning regarding blank cases. And there's a question that I want to answer by Joaquin. He says, good morning, can we lower the deviation of the answers of the battery related to that intention of lack of veracity in the answers? Well, Joaquin, in my experience, where people don't trust the organization, when people don't trust that the information they are going to give is actually going to be good for them, they lie. The most important thing to do in any evaluation that you're going to carry out, is that people feel that they can trust that their information is going to be protected and that their information is going to be useful for something. If some of you work in organizations that have carried out this battery several times, when people see that the first application didn't have any results, they didn't even know what happened afterwards, even though they demonstrated there were lots of problems, nothing happened. So what's going to happen the next time? Well, people just say, well, then I shouldn't even answer it because finally nothing's going to happen. Or when people know that the information is not being protected and that their boss is not going to, when their boss is going to know them, well, they're not going to tell you the truth. They're going to tell you what their boss wants to hear. That is a problem with certain instruments when you don't know how to use them. So in my opinion, the best way to guarantee that people are not going to be ill-intended or are not going to be truthful is that the organization really informs the people and guarantees that the information is protected, that it is going to be protected, and that results are known to everyone and show that it was worth answering the evaluation, that it's going to work for something. Because if it's just to comply with the law and avoid sanctions, then really as an employee, it doesn't matter, right? I just answer anything. But if I see that it actually benefits me or my organization or my working conditions, then of course I'm interested in telling the truth. I don't know, Sebastián, what you can add here. Well, yeah, they reminded me about two important things regarding, especially for this.
Como yo les mencionaba,
as I was mentioning, I am the founder and director of Prax, which is a company specialized in evaluation and diagnosis, and we have a software for this. All of the companies that are affiliated to SURA, your SURA is giving you a license to use this software, and there you can use it to do these evaluations. Why do I mention this right now? Because one of the things that have been more valued for workers and employees themselves is there is a third party, like Prax, for example, that guards the information and guarantees precisely that there is a good use of that information. All of the companies who wanted to do psychosocial risk evaluations, and if you are affiliated to SURA, you can go to our website. Simon, please, in the chat, the link, and you can be comfortable feeling that with that system, it's going to be a centralized administration of the information by a third party that is not going to reveal data because it's wrong and because they are protected by the law. And this also connects with another message that I think is going to answer a lot of the questions I'm seeing, and is how do we measure if we wanted to measure beyond what we have in the battery of the ministry? Well, we're working on liberating, I hope, before we finish this cycle, an evaluation of job stressors that uses JCQ mainly, of the demand control model, and instruments for rewarding balance. Those instruments, we have the authorization of the authors, by the authors, to use them in Colombia, but those are instruments that are not for sale, they are not commercial, they could be used through the system. You as companies that are affiliated to SURA could use them. But now then you need to take into account that those instruments and that evaluation that you want to put out is not to comply with the law. That is not going to be useful for you to present in an auditory or an inspection of the ministry. Because in Colombia, we know there's specific regulation that most of what they're saying is that you need to evaluate with the battery of the ministry. But if you do want to do complementary evaluation and have extra data and evaluating other indicators, then you can do that with this. In the formulary for resistance that we have today, we had a question. If you would be interested, even though you know this is not what the law requires, if you would want to use an evaluation like this one, so please give us your opinion, because that can inform us if this is going to add value to your needs.
Varias personas que están preguntando.
A lot of people are asking if first, if the evaluation has to be carried out by a psychologist. According to the law in Colombia, it has to be a person that is specialized in health and psychosocial risk, which I don't agree with. I have said this many times. I think it should be someone who knows about evaluation and knows about evaluation, but psychologists know how to do this, but not only psychologists know how to do this. In other countries, people who evaluate this and intervene, they can be sociologists or epidemiologists or people who you've heard so far in this cycle. They are not psychologists originally, so they have become trained in order to do a lot of these things. On the other hand, regarding what Sebastián is saying, we are trying to offer ways, alternative ways of evaluation to the battery of the ministry, which in my opinion has a lot of problems. One of them is that it only can be applied virtually. Some of the questions, if there is some scientific evidence that allows them to know that the results are different, and the answer is no. There are no evidence for any tool that answering it on paper or virtually is going to have any difference. And it also has other problems that I don't want to mention right now, but we, as Sebastián was mentioning, we did a battery that was applied to Prax for a long time because it was validated in Colombia and because it complied with the norms of the law, and because there's a lot of people doing crazy things and evaluating with things that are not proper, and the ministry just decided to block everything and say that the only battery that could be used is the one from the ministry. We even established, we presented a demand and we established a process, a judicial process against them because we don't think this makes any sense at all. So we think there are alternatives if you want to do them because you're actually interested in the topic. But as Sebastián was saying, this doesn't work to just comply with the law because for them, you need to apply the questionnaire that the ministry gives you. The questionnaire of the ministry is what's mandatory. Oh no, because I'm talking about the battery. Some people are asking if we know there's an update of this battery. They haven't done it and they should do it. They are falling behind of doing an update and collecting data. My fight has always been the ministry should have a way of recollecting in a database, national database, the data of all of the companies. And that would allow us to know national data to compare occupations, gender, and make decisions at a national level. What they haven't done it, I don't know, but I think it's important. And the battery requires a revision. But for that revision, then we would need the data of the companies, and we don't have that. So I don't know how it would have to be a collection of new data because all of the data that have been collected so far wouldn't work for this revision. Yes, Sebastián, go ahead. Just some quick questions, two very specific questions. The Prax is recognized by the ministry. Well, the ministry it doesn't recognize or not recognize. I think this just comes from, it's beyond their control. What we can say is that in Prax, because of this new evaluation we're having, we have the evaluation of the battery as well of the ministry, which complies with all of the law requirements. You need to have a specialized psychologist, you need to do it on paper, etc. All of the things that the norm says today. And also, alternatively, we hope before the end of this cycle, we hope to create a new evaluation that is going to complement everything that has to do with the ministry's battery, and that is not with the purpose of complying with the law. They are also asking if workers can demand to see the results of this battery. Yeah, that's your right. Every worker has the right. You can ask for access to your individual results. Now, the employer cannot ask for them. You cannot give them without your authorization. You only give them to the individual worker after they file a form with a signature and everything, precisely because this is sensitive information and we need to take care of those data. Someone also is asking, what is the purpose of focus groups? Well, in the ministry, to evaluate a group of risk factors through this methodology. But Sebastián, wait. The focus group, as I said before, has the advantage that it allows to go into more depth. But ideally, you would have done the questionnaire first, and then with the focus group, you would go into detail about more details. Or even if you have the indication or you have detected that in certain area, in certain group, people are complaining because they have too many demands or they have a lack of control, a way of defining how to carry out this intervention is through a focus group. I think that Laura Punet is going to talk about this, how to use focus groups in action and participatory action, which is you ask people, you have a hypothesis, you have ideas, and then you evaluate them with the group. Focus groups are very, very important to go deeper to interventions and evaluating them. When they are used only for risk evaluations, people there identified, and people are not going to tell you anything if there's no work behind that.
Una pregunta me parece muy interesante.
I found a very interesting question. I don't know if you have others. I think that we have time for just one more to respect the time of everyone because we're also over time. Yeah, that's a very good question from Marta that says if workers can demand
Yo
their
creo que por
results should be shown. I think yes, they should be carried out. That it should be. If you are evaluated, you need to know your results. But I don't know the details of the law. Yes,
Ahora sí,
that's
por
what I
supuesto.
was mentioning. Yes, you have the right of
Nadie te puede decir
access to the results. No one can tell you you can see the results. You
Lo
should
que
be
uno tiene
able
que
to see
cuidar
them.
es
If you want to see them, what you need to be careful is to not give them to anyone who can't.
Pero ahí tú te
But wait. Because here you're talking about individual
los
results,
resultados individuales.
but individual results are not saying much. So
Son los
the
resultados
important results are the organizational results. Oh,
yo
okay.
trabajo en la
For
Universidad
example,
de
where I work in Los Andes University, the university carried out the evaluation, and yeah, there was an announcement and everything, and there, absolute silence. They never said what the result was.
debería
Should you
diga, miren,
you
la
should receive an
universidad o en tal
evaluation
parte.
that says, okay, this company detected that they were doing okay in these things and not so good in these other things, and yeah.
Por eso les decía yo al principio.
So I was saying, if the organization does that and it's committed to do something with the results, I think a lot of organizations really are not, because they don't want to do anything with the results. They save them the work and the interventions and everything with the blank cases they detect, and that generates is fear in the employer and lack of trust. Next time, no one is going to answer.
Creo que ahí hay falta de
So I do
educación.
think that that's a lack of education. And organizations need to understand that this is not only for complying with the law, and this benefits them from a lot of point of views in your own economy, their own workings. It's good for them to carry out the evaluation and take it seriously, right? Otherwise, you cannot expect people to take it seriously. Yeah, legally, at the normative level, companies are not obligated, but I do agree with you, it's a technical recommendation, because evaluations are ways of establishing dialogue and communication between workers and employers. So what happens when a worker spends 2 hours answering a survey and nothing happens afterwards, they don't even know the results? Well, then we are not reinforcing that behavior, that that person should participate and be honest and report what they're thinking.
Los protocolos y en la
The protocols and the methodology that we have in the system, we see some messages that are specifically made so that the company communicates the results and workers know what's happening. They are not obligated by law, but technically they should do that.
que hace María
I
Eugenia
have a
Quintero, que me
question by
parece muy
María Eugenia Quintero that I think is very important. I want to know about the scope of the intervention for individual results and what model you know to intervene in individual factors. María Eugenia, after 10 years of getting this question asked, I have become really strict in answering this. You cannot do anything from the individual
no es relevante, no es
side,
importante,
because that is not relevant to control the risk factor. Now, if you carry out an evaluation of psychosocial risk factors for epidemiology purposes, then you're using the wrong mechanism, because it is not made for this sort of information. If during your measurement you detect that someone is stressed out or sick, I recommend that you remit them or send them to a professional that can help them, and the company needs to evaluate and determine if that disease that person was generated because of working conditions. So they are obligated ethically and morally and legally to changing those conditions, not only for that individual, but for all of the workers that might be exposed to these conditions.
Fíjate que sí, perdóname, te interrumpo ahí.
But Sebastián, I'm sorry to interrupt, but if a company had a program of surveillance, they don't need to go after the person is sick to evaluating these conditions. If you are evaluating them regularly, well, how long? Every year, 2 years, depending on the results themselves and depending on the amount of health problems they have. But if you do this regularly, if someone is sick, I can just go ahead and and go to that person and say, okay, this is not a general problem, this is not a risk for a group of people, so you can just look at a particular case. But that should be just for, that's different. This is not the responsibility of the company to do individual interventions. And believe me, a lot of people doesn't answer with the truth because they are afraid that they will be identified as I am sick because then I'm going to lose my work. And that should not be carried out because that produces fear in the people. What's the responsibility of your companies is to make sure that the working conditions, psychosocial working conditions of your collaborators are good so that you don't have problems because of the organization. If they have them, it might be because of family conditions or anything like that, but not from the organization. But the organization is not responsible. And when you do preventive interventions, it's better. I'm sorry, Sebastián. Yes, I think you're right. I would also share that you need to be really careful because carrying out these individual interventions, apart from the fact that they don't work because they're not going to solve any problem, they also put the guilt on the workers, like telling them, okay, you're stressed because of certain conditions that I am giving you, but it's your fault to not be able to cope with them. Yeah, so that creates an additional problem. And also, additionally, this is going to generate in the organization a psychological effect of tranquility, and you can relax because, oh, I did something about the problem, even though that is not going to actually solve the problem. So, and I have become really strict regarding this. P&L coaching and all of those things that are directed towards an individual, think that I have to change something in the individual. That's not what solves things.
De riesgo psicosocial asociados al liderazgo.
Only we are talking about leadership
El líder en el fondo
problems, psychosocial risk factors, because a leader is a source of work organization. So if the leader actually has a problem, a lack of knowledge and skills for organizing healthy work, because they can be an efficient leader, they can guarantee the results of the company, but they don't know how to achieve these results in a healthy way, then I do have to work with an individual, but not for the individual itself, but because the lack of knowledge of that individual to organize work of other people is not appropriate.
Yo insisto
I insist on this. And I want to ask my colleagues, let's stop psychologizing the phenomenon of work stress. Working stress is caused by organization of work. Viviola, I want to propose to everyone that because we have so many questions and we are already past our time, this video, this conference is going to be in YouTube, and we have the option of comments there. So any question that we didn't solve here, just throughout the afternoon, in the comment section, ask the question, and we will look at them and try to answer as many of your questions as possible so that we can respect the time of everyone because we need to go to lunch. Yeah, just a quick announcement before we leave. Starting from next week, we're going to talk about resources for evaluation, resources for intervention, and we're going to have 3 sessions that you cannot miss if you really want to know about resources, how to read about these, where to find the tools to evaluate the case, how to intervene the organizational conditions, and how I carry out interventions based on the leaders, which is the last session. So don't miss those. And thank you, everyone. Thank you, Viviola, and everyone for attending. We'll see you next Friday in the next session.
Día para todos.
Happy days to everyone.